Tell you, I am in a public setting. Is my background noisy?
No, it's fine.
Okay, cool.
Eh, Hi
Okay,
everyone. Oh, go ahead.
hold on, go ahead.
Okay. Hi everyone. I'm Safika, one of your HOSA committee chairs, and I'm so excited for tonight's event. We're thrilled to welcome a wonderful guest speaker who will be sharing her experience in the health and wellness field. So before we begin, just a quick reminder that there will be a QR code at the end, so be sure to stay till the end to receive a credit.
And I'm Krish, also a committee chair. We're excited to learn from our guest speaker tonight about her journey and experience in health and wellness.
Hi everyone, I'm Saprita and I'm a part of Sophomore Council. I'll also be helping host tonight's session, and we're all really excited to hear about how wellness-based care connects to the broader health field.
Okay, without further ado, tonight's guest speaker is Miss Amber McAfee, the owner of True Rest Float Spa. On behalf of Alliance HOSA, we're honored to have you here and excited to learn more about your journey in health and wellness. To start us off, could you please introduce yourself and tell us a little about your role and the work you do?
Awesome. My name is Amber, and as presented, I am the owner of True Rest Float Therapy Spa in Georgia, North Georgia. My husband and I opened that location in August. We got to know some of your advisors, which is kind of how I got to know the opportunity to do this presentation. My journey started many years ago, right after high school. I didn't have the type of parents that pushed academics and like, where are you going to study and what are you going to study? You know, your junior year, your senior year of high school. My mom was a hairdresser. Not a shock with this hairstyle. My dad was a home remodeler. My stepdad was a farmer. So I grew up very like skilled trade learning and everything. And high school was very easy for me. I just academically, I barely studied and I got good grades. But then when I got to college, I didn't know what I wanted to do. So I went to a community college and I floundered because they don't spoon feed you the information like they do in high school. It really requires you to apply yourself. And I came home one day and on my caller ID, it said the United States government was calling. It was the month of March of that year, so I freaked out thinking that I had filed my taxes incorrectly. The IRS doesn't call you, they send you letters in the mail. But I thought I had done my taxes wrong. So I called the number back, and an Army recruiter picks up the phone. He says, United States Army recruiting. And I said, my name's Amber, and you called my house. Well, I had a recycled phone number from somebody previous who had been thinking about joining the Army. So when I get to talking to him, I'm telling him, I'm not doing so great at school, really don't know what I want to do. What would happen if I joined the Army? So he starts telling me all these benefits about joining the Army. I literally took the placement exam and left for basic training 2 weeks after a wrong phone call and joined the Army. When I got there, I was not athletic. I was a fish out of water. I was the slowest runner. I couldn't do any push-ups. I couldn't do any sit-ups because I was not athletic. In 8 weeks, I graduated top of my class. The job that I chose was to become an operating room specialist and medic. And when I got to learn how to do IVs, intubate people, save lives, I knew that I had done the right thing by joining the military. I was also given the benefits of being able to go back to school with the military benefits. However, at the time, being young, I didn't take advantage of it, which I did regret later in life. So I became a combat medic, an operating room specialist. And what I was trained to do was go to war and set up a field support hospital. So if any soldiers were injured at any time of conflict, me and the team would take care of them. I happened to never have been deployed, so all my service was stateside. So I took care of soldiers in a medical setting that maybe had a hand crush or lost a limb or came back from a conflict overseas and maybe were burned or whatever. It was a high adrenaline rush. It was life-saving. I felt like we're putting people back together. I absolutely loved it. I finished my term of service and I went back to my hometown in Ohio, which is where I'm originally from. And I was trying to get a job either at the fire department to be a medic or at the hospital to work in surgery. And neither one were hiring. And so I was waitressing. So I'm waitressing and I'm waiting on these older retired gentlemen, and they called themselves the Romeo Club, retired old men eating out. They came in every day for coffee. One day they brought a different older gentleman with them, and they said, Amber, tell him about your stories being in the military. I fill him in. I tell him I'm an Army trained medic, an operating room specialist, and I really would love a job at the hospital. I get home that day and there's a call, answering message on my answering machine. The the hospital was calling me in for an interview to work in surgery. When I went in for the interview with the HR department, the CEO walked in. Well, it was the gentleman that the older group that I had waited on at the restaurant brought in. He was the CEO of the hospital. So, wrong phone call. I joined the Army. Wait on the CEO of a hospital. I got the job in surgery. I worked there for 4 years. I learned how to suture. I learned surgeries from doing corneal transplants from eye donation, heart valve replacement, broken hips. I helped deliver babies, do all these things in this town that I lived in Ohio. Loved, loved, loved it. One day, they're wheeling, a funeral director is wheeling a deceased person out of the operating room. I went to the nurse manager and I said, what happened to that individual? She said they had died in a car accident, but they are an organ donor and they are donating their organs to save the lives of others. I found out about that organization that does it. Every state has one. Interviewed and applied. And my first day on the job was the September 11th attacks. The government gets a hold of us at this organization and says, if there's any potential organs or skin donation to help the survivors of the towers collapsing, we are to drive it to New York City to help protect everybody. And I knew from that moment I would be in the line of first responder, taking care of people, saving lives, organ transplantation, skin transplantation, all of the above. So the point I'm making about those, the universe set this path for me, and I chose the right fork in the road and listened to my gut and almost listened to kind of what I knew my heart would want to do. And so it's never been a job. It's been a career. It's been a love. It's been a passion. I've met people whose organs I helped remove from the deceased person, and now they're walking and alive because they were transplanted into the next person. And it has been truly rewarding and amazing. I'm sorry that was so long, but when I get on that spiel, I have to tell it all.
That's really interesting. So to dive a bit deeper, can you walk us through your career journey and what exactly inspired you to enter the health and wellness field?
Absolutely. So if you know that you want to be a caregiver and do right by others and get rewarded off the mission of kind of like taking care of people at their worst and seeing them be their best, do their best, thrive to their best, then healthcare is the right thing for you. Which is kind of why I got into the float therapy spa, because as I kind of sunsetting in my career and doing less of the patient interaction hands-on, I wanted to do something in the health and wellness field where I could work for myself, but still have that caregiving atmosphere. And I would venture to say that anybody considering getting into healthcare, it can be very rewarding in the respect also that it is recession proof. So there's always going to be the needs in healthcare. So if you pick a certain career, you know that there is still the opportunity to help save and enhance the lives of others without maybe suffering the detriment of certain things going on in politics or in business that affect your career. There's still always sick people. There's still always people to help make feel better. And it's rewarding when you drive home to know that you enhanced and made a difference in someone's life.
Did you know you always wanted to work in this area, or did your path change along the way?
My path changed along the way. Like I said, it was pretty darn mysterious that I got the mistaken phone call from the Army recruiter. It was pretty darn ironic or serendipitous that I waited on the CEO and he said, "Oh, this young lady needs a job at my hospital." Later in my life, I wanted to finish my degree and get my master's, and I didn't quite have the funds. And although your advisors would probably tell you not to listen to this advice, I was gambling. It was my first time ever playing Texas Hold'em poker. I won a progressive jackpot for over $25,000. The first thing I thought of was not to blow the money and go shopping and do all these things, buy a car or whatever. I went back to school with the money and I got my master's degree in business because then I knew that I could combine my clinical acumen that I had gained through the military and all my hospital experience. And then I got a business degree to kind of bring those two together and then focus on what kind of led into the next steps of my career, which was when I became an employee of Exerco Medical. And at that organization, I was the first woman with a master's degree to join that organization. So I kind of felt like I was breaking a glass ceiling. And I also became a patented inventor at that organization. So one of the things that I have never let kind of get me down is if somebody says, "Oh, no, you can't do that," or "There's no way that could happen." You could say it's stubbornness. You could also call it persistence. And my husband will tell you if someone says, anybody tells Amber that can't happen, that just gives her more energy to go show the world that it can be done. And I'm very proud that I have invented several products that help save lives in the industry.
Wow, that's so inspiring.
Thank
What
you.
were some of the challenges that you faced while building your career or starting your business, and what kept you motivated through those moments?
Some of the challenges would be probably individuals second guessing life experience versus a degree, because I truly believe that you can grow in your career with a combination of the two. So for example, I'm a patented inventor. I'm not an engineer, but I know how to operate and I know how to assist surgeons in certain surgeries. So I was lucky enough to be paired with an engineer where I could describe things and we jointly became the inventors of products. So my advice to that is basically don't let someone tell you that you can't do it, and don't be afraid of change. The whole world revolves on change. Everything in medicine is, the next innovation, the next thing that makes things easier to do a surgery or to save someone's life. And I feel like what I was able to do is kind of never take no for an answer. Like anything can be done. Maybe it takes longer to get there, but anything can really be done. And that was my attitude throughout my career.
So what exactly does a typical day look like for you as the owner of True Rest Float Spa?
Well, I make my husband do everything. No, I'm joking. We are co-owners, and I still have a job in the healthcare space. So I'm currently working for a pharmaceutical service company that helps patients who receive transplants. But what I do for True Rest is the financial analysis, a lot of the human resource, basically hiring, training, kind of making decisions for the business, because at the age that I am, in about 5 more years, I want that to be my sole job. So I'm very invested in that. My husband does the day-to-day operation. I do kind of high-level stuff. Also, I wasn't really ready to get away from being involved with patients. So I still get to be in the hospital setting and see people come through the other side of an organ transplant or a skin transplant from being burned.
What types of clients do you typically work with, and what are some of the most common reasons people seek float therapy?
Oh, awesome. Yes. So for float therapy, there's a category of mental benefits and there's a category of physical benefits. So for mental, we see a lot of people with high stress, anxiety, depression, insomnia, PTSD, which is post-traumatic stress disorder or syndrome. And then on the physical side, it could be chronic pain, arthritis, joint pain, spine pain, fibromyalgia, or maybe even a disease such as ALS, Parkinson's, spina bifida. We do see and service a disabled population that get a lot of relief out of float therapy, which, let me explain, is the opportunity to be in 1,000 pounds of salt, 10 inches of water, 95 degrees, in a pod. You feel like a baby in a womb, and you experience weightlessness for an entire hour. And what that allows is Earth's gravity to not pull on your muscles and your joints, but also your mind to go to a place in your brain that we oftentimes don't shut down. So all day long, we are in what's called a beta state of mind, fight or flight, decisions, watching to make sure somebody didn't run a red light, watching to make sure you're not on your phone when you're driving and texting and all this. And all these things are coming at us. A theta state of mind or a delta state of mind is where you can meditate, shut the world off, and reach parts of your brain that really truly is like REM sleep or euphoria or meditation. So stop looking at a phone, go to a place where we're literally experiencing nothingness, and it makes your brain reset. It makes you more energized, or you get a better night's sleep. And I fell in love with it for different reasons than my husband. I'm more the physical, love the physical, sore neck, high stress environment. And he likes the decreasing his anxiety and getting a better night's sleep. And there's nothing more meaningful than when somebody tries floating for their first time. They spend the 60 minutes in the pod and they come out and we say, "How do you feel?" And they're like, "That was amazing." So your body will suck in the magnesium sulfate and release lactic acid while you're in there. So it kind of feels like getting a massage without even being touched.
That's awesome. Have you seen any particularly meaningful or memorable outcomes from clients using floating therapy?
Yes, we have a older gentleman who was a Navy SEAL who was in, he won't really share exactly, but he was our very first member, one of our very first floats, and he used to experience nightmares from what he witnessed while away in the military. And it is helping him decrease his nightmares and his anxiety and his PTSD. And so that has been a really wonderful transition to watch. And then also we have a couple older ladies who have severe osteoporosis and are like kind of more upper back hunched over, and they are experiencing great spinal relief by being inside the pod. And again, this is no medication or anything like that. This is like just a self-care routine by soaking in the Epsom salts, and they're experiencing a little increase in their mobility in their older age and decreasing with the feeling of arthritis.
Are there any common misconceptions people have about float therapy or wellness-based care that you like to clear up?
I'm not sure there's any kind of like misconceptions. I think it's more just the unknown and what to expect. And float therapy has been around since the 1950s, but it's only gotten more popular in the last like 5 or 6 years. I should say 6 or 7 years. Anyways, I joke. And so a lot of it is questions about what to expect and will I feel the results after my first float. So misconception might be if somebody's just unbelieving that a small little hour of self-care can make a big difference. But we do our best to answer all the questions. We like people to try floating more than once. And we like to know what you came in there for so that we can help you get the best experience out of the float session. So if it's mental or physical, then we can kind of guide you on what to expect or think about while you're inside the pod. So misconception, not so much. It's maybe just unknown.
So, what are some skills that you think are important for someone to succeed in the health and wellness field?
Definitely tenacity, especially if you become your own business owner. Like when I got to know the three of you and before we went live, you're all interested in being some type of practitioner or clinician. You may work for a hospital, you may venture out in your own practice, but definitely tenacity. Stay current with industry trends, stay current with what the government puts clinicians through in terms of things changing for healthcare reimbursements and insurance companies. Because if there was one thing I hear from any of the doctors I've ever worked with is they went to medical school to help save and do all these things in people's lives and heal things. But oftentimes the insurance makes them navigate things a certain way that a clinician would decide to do differently if it weren't for the prescriptive care of insurance. So you have to battle those regulations. You have to battle the ever-changing things that go on with the Centers for Medicare and Medicaid and Health and Human Services that we as a country vote for and leaders, instill upon us. So navigating the way you want to be a practicing clinician along with what the United States says we can and cannot do. So tenacity is the big thing. And my opinion is to stay true to helping lives. Like sometimes there'll be patients that can't afford things. And if you went into this to be a cardiologist or save lives, sometimes the altruistic opportunity to provide someone care can be more meaningful than the person who's able to pay for it. In my opinion, I'm kind of like everybody deserves an equal opportunity for a caregiver to provide them what they need.
You mentioned working as a transplant preservationist and a tissue banking specialist. Can you explain what tissue banking and transplant preservation are in simple terms?
Yeah, absolutely. So I had the opportunity to learn both early in my career. And a tissue banking specialist is when somebody is a deceased donor and they are cardiac dead, meaning their heart has stopped. This could be a stroke, a heart attack, a car accident. It could even be a homicide, suicide. And they said yes to donation on their driver's license. So with their heart stopped, what they are able to donate is their eyes for the corneas, their heart for the heart valves, their blood vessels, their bones and tendons. And so I was trained to surgically remove all those things from somebody. It's not a doctor that takes them out. It's a tissue recovery specialist. You have to be a doctor to put it into somebody else, but we are trained by doctors on how to do it. An organ recovery specialist or organ preservationist, we travel with the doctor to a place where somebody has been pronounced brain dead. So they are still on a ventilation system or life support, but their brain has ceased to function. So if you were to remove the ventilator, they're no longer going to live, but they're clinically pronounced brain dead. So if their loved one or they chose to become an organ donor, they're taken to the operating room and they have the opportunity to help people who need a heart, lung, liver, kidney, pancreas, intestine. I've also been involved in the nation's first face transplant and upper limb transplant, so hands. And what I would do for that is scrub into the surgery, assist the surgeon. I would help prepare the blood vessels. I would help exsanguinate the organ, which is basically remove all the blood, put the preservation solution in to keep the cells live and viable until that organ gets transplanted into someone else. It's a very high adrenaline situation. Certain organs can only be out of the body for a certain period of time. So if I were involved in a heart donation and the person in the other hospital waiting for the heart, we had to get it from the person dying to the person receiving the transplant within 4 hours. So oftentimes we're flying in a helicopter or a private jet, depending on how far away that donor is. And again, I preface organ donation by saying that there's the United Network for Organ Sharing, and they list all the people who are sick by organ, by blood type. It is a fair and equitable system. You can't pay your way to the top. And if you're famous, you don't get the organ first. It's dependent on your blood type, how sick you are, and your status on the list.
So what is one challenge you face in this field and how do you handle it?
Seeing death so much was a big challenge so dependent on what you choose in your future clinical careers, if you were to choose oncology or pediatric diseases. You're going to have to prepare yourself to mentally understand what you may feel when you go home after seeing so much sadness, because not every patient makes it. If you're in transplant, you're seeing someone pass away. That has been a challenge, to not let that get in the way of continuing to do right by donation. So for me, what I like to focus on was, I was a steward of the gifts. Out of something sad and tragic, I was helping a team of clinicians get it to a person who was going to die otherwise, and see them come through the other side and live. The other thing is, take care of yourself. Caregivers oftentimes can get caregiver fatigue, and there have been restrictions put on residency programs in medical schools, that you can't overwork the students and the residents, because there is caregiver fatigue. And so it's another reason why I got into float therapy, because I can talk to the hospitals in my area and say, send these caregivers on into float, and reset their bodies, reset their brains, and continue to do really well at their hospitals or in their practices.
How does your work help improve outcomes for transplant patients?
So you can tell that I have a very varied background. So my work at the job that I hold now, outside of being the owner of the float spa, is I travel to transplant centers and offer mail order pharmacy services. So when you are a transplant recipient, you have to take immunosuppressive medications and anti-rejection medications. So the company I work for now kind of makes it easy for that patient to receive their medications mail order at home, so that when they do come through the other side, that's one less thing they have to worry about. We remind them of the importance of getting their refills. We remind them of certain things throughout their journey, such as nutrition, staying healthy, self-care for themselves, their caregivers. Just because they got a transplant doesn't mean all the medical issues went away. It's kind of like a trade from one to the other. So I've just always been, for several years, I've been in leadership, but I describe myself as a servant leader, and also a leader that rolls up their sleeves and helps. So I wouldn't ask anything on my team that I wouldn't do myself. And that has always remained meaningful to me. And kind of has always been, all the people that have worked for me or been on my team have enjoyed me as a mentor and a leader or a coach, because I don't just delve out what needs to be done. I'm right there doing it alongside everybody.
What is one thing students might not realize about careers in tissue banking or transplant medicine?
Oftentimes people who end up in organ preservation and tissue banking side are medical students and residents on their way through their journey. So they end up working for the organization that does it. It's called an organ procurement organization. There are 58 of them around the United States. So a lot of times medical students are doing that on their way to becoming whatever type of clinician that they are. And what they may not know is that there's a college to go to do that and become a specialist in that. And you earn a degree in donation science, and it's at the University of Toledo, which is actually where I was just earlier today. But otherwise, it's kind of an unknown career. It's very niche, but once you're in it, you're usually in it for life, because it's such meaningful work, to be honest.
Moving on to healthcare connections and industry insight, how does flow therapy complement traditional healthcare or medical treatments?
So what it can do is lower blood pressure. It can also potentially help with insomnia and better night's sleep. I spoke about that earlier. It could potentially, this has not been cited in a medical journal, but it could potentially lessen someone's need for certain anxiety or depression medications. because they reach a meditative state. They reach a state of theta or delta, a very euphoric meditative state that gave their brain a period of calm. Now, we never say, oh, you feel great after floating, stop taking your meds. But as an adjunct to where like maybe the meds don't take the edge off in whatever kind of stresses you out or your anxiety, but by adding float therapy to it, cumulative or as an adjunct, it really helps with those mental conditions, and as well as like arthritis and some of the chronic pain conditions.
Do you collaborate with healthcare professionals such as physicians, physical therapists, or mental health providers?
Yes, we do. We right now, because we just opened in August at our Georgia location. Right now, we've worked with a lot of massage therapists and chiropractors. In our Ohio spas, we've worked with athletic departments. So the Ohio State University football team would come float for their like physical, muscular rehabilitation and recovery. And then you guys will learn this when you get out into the field and have like healthcare coverage and everything. You can reserve a portion of your paycheck to be like flexible spending or pre-tax dollars. And a lot of the big businesses will allow you to do floating as part of your healthcare and give you employee reimbursement or let you use your insurance towards it, because it's part of that wellness care. It's part of that reset. And the other thing that we have helped with is addiction centers. So people coming through the other side of giving up drug addiction have experienced a lot of like bringing down that anxiety or those withdrawal symptoms from giving up certain extracurricular kind of medications that aren't the best for you.
What are some of the safety or ethical considerations that are important when providing wellness-based services to clients?
That's a good question. You want the person about to go through either the experience of floating or the experience of whatever procedure or healthcare to be informed. Explain to them, because a lot of people just by nature will get a consent. You're having a procedure, you just go to the bottom line and you sign it. Well, you really do need to be aware of the risks of what procedure or floating or whatever experience you're about to go into. So I would say those of you who want to be a future clinician, don't breeze by that stuff and don't let people get like what they call like white coat syndrome. Like just because the person's standing there and they have a white coat on and they're a doctor, that they're just going to do everything right. Well, you still have your own questions. You're your own advocate. So make sure that you inform your patients and make sure that they understand. You might need to order a translator because they don't have English as their first language. You can't always assume that the husband or wife translating is saying exactly what you mean to say to the spouse, because they may be sugarcoating it or like breezing by something that's really important that individual needs to know. My experience, you have one life to live. No one deserves to be lied to. No one deserves to be taken advantage of. You're your own advocate. So if you, as future clinicians, make sure that you always explain and ensure that that person's really comprehending whatever it may be, then at the end of the day, you know you've done right by that person. So like in float therapy, I make sure if you're claustrophobic, you don't have to shut the doors. You know, if you feel nervous, you can get out. Like that's just a very high level kind of explanation. But in my healthcare space, I used to talk to pregnant women who were giving birth to donate their placentas to treat the patient, people who suffered from burns. Well, you're not just giving your placenta for me to take the amnion tissue and go save someone's life who's been burned. I want to explain to you what it's going to be used, the testing it's going to go through, how many people it can help, so that you're making an informed decision before you choose to donate or go through a procedure.
What educational background or courses helped you prepare for this career?
So I was after the military, and then in any job I had, when there was opportunity for going to a conference or continuing education, I took advantage of it. I very much wanted to always achieve whatever was available and earn that credential. So if you can become a specialist in your field, you'll see doctors have MD after their name. But then there are some who have MD FACS after the name, which means they went further to better their credentialing in a specific field. Sometimes people go after it for earning potential, and that can be what it brings, but oftentimes it's to go after it to hone your skill, be better at what you do, be able to educate to the fullest extent, and stay up on industry trends. So when you become certified in certain things, you have to do the continuing education to stay current. Like, for example, doctors 30 years ago couldn't do surgery with the Da Vinci machine, right? Now, if you've heard of the Da Vinci, that can cut cancer out of you without even opening your entire abdomen. Well, had those doctors who've been around for the last 30 years not stayed ahead or in tune to their industry trends, they wouldn't have learned how to do a robotic surgery. And it's a better way to come through the other side of a major procedure, having not have to be completely opened up during the surgery. So get yourself credentialed, stay attuned to industry trends. Those are probably the two biggest. And don't be afraid to change, because that's what innovation's all about.
What qualities do you think are essential for students interested in healthcare or wellness-related careers?
The first thing that comes to mind is bedside manner. I don't know if you've been to a doctor where they take forever to come to the room, or after they leave the room, you're like, oh my God, I felt like I couldn't ask that one other thing or that one other question. The providers that I have been around that have an astute bedside manner for whoever is in front of them, a male, female, a transitioning person, of a different ethnic culture, just have a really open kind of bedside manner or atmosphere about you, so that they have that sense of being comfortable that they can ask those questions. I'm not sure that there's a lot of focus on bedside manner in medical schools. And the doctors that I have worked around who I can see the patient warm up to, or simply laying your hand on them, like their hand, it's like a caregiving atmosphere. They're scared. They're scared. And if you are vulnerable and show your human side, that goes a lot farther for that person who maybe even doesn't have a support system and they're there by themselves. They're in an emergency room. They're in a car accident. Like, it can't be so methodical that you forget that that's a human sitting in front of you that needs care, So bedside manners, like, I think my big thing.
If you could give any piece of advice to high school students who want to pursue a career in healthcare or wellness, what would it be?
Ooh, let's see. I think healthcare and wellness is a great field to be in. The advice I give is, don't pick something that by default sounds easy or by default doesn't have a rigorous call schedule. Pick something that you would love to live and breathe. And so that way it doesn't feel like a job. It feels like rewarding, because you don't want to drive to work every day like, why did I pick dermatology? I'm just picking something. Why did I pick this? It's so boring. I want something, I wish I was in the ER, more adrenaline rush. Make sure if you're going to medical school and you're doing all your clinicals and your rotations, expose yourself to as much as you can so you can fall in love with what it is you want to do, because then you'll never feel like you work a day in your life and you'll love it.
How do you see the health and wellness industry evolving in the future?
I think there's going to be more AI interaction, more telemed. AI meaning presumptive things. I think that there's going to be a real change in innovation for, I'm kind of ad-libbing because this isn't really my space, but like evaluating blood work combined with an MRI and AI predictive off statistics to say that this could be a diagnosis. Like, these three these 3 to 10 diagnoses can't be ruled out, but based on this formula of this clinical picture, test the person for this next is based on predictive AI. Could be what the disease state is, or this could be what's happening. I also think there is a future in 3D printing of organs where someone needs a kidney and it can be 3D printed. And then we create the vascular structure and the ureter structure to transition, the toxins out of the blood and create urine, where that person's own cells were transfused, implemented, embedded into this framework of something that is not human, but was something made of organic cells. And we will be live 3D printing human organs in the future. Now, I would think it's going to start with the easiest organs. So heart and lungs would be difficult, but a kidney, not to say a kidney is less important, but a kidney structure is probably more easily to be replicated, especially since xenograft, which is a transplant from a animal, a pig kidney is very similar to a human. So I think that could be the future. We might see it earlier in tendons and bone and skin, but organs, I do believe it will happen. In my lifetime, I'm not sure, but I do think that's going to happen at some point.
How do wellness businesses like True Rest play a role in long-term health and preventative care?
Well, I think if you have the ability or the income to add something like float therapy or massage therapy, chiropractic therapy, whatever it is you believe in, it can be cumulative and maybe keep you from having a more progressive arthritis set in, more progressive depression set in. We don't know a whole lot about how floating could help things like dementia or Alzheimer's, but there have been studies where floating has eased the anxiety and the mental disconnect for folks with anorexia. So it's helped them get through the other side of an eating disorder. That's outside of my space of work, but I have sat through presentations where the doctor has had 20 women, 10 with all 20 have anorexia, 10 who go through float therapy, 10 who go through traditional therapy, and the float therapy added to their regimen. They came through the other side, clearing that body dysmorphia and getting through anorexia, and being able to stabilize those thoughts about their self-image quicker than the group that did not have float therapy. So float being added to things like mental disorders, autism, and things like that is just on the cusp as well of knowing what the future could hold.
What does teamwork look like in the transplant preservation, and who do you usually work with during the process?
Teamwork is big because when you're an organ donor, however it is that you had suffered an injury, the hospital has done everything they can do to save your life. They do not call the transplant professionals in until they have exhausted all efforts. A common myth in the industry is if I'm in a car accident and it says that I'm a donor on my driver's license, they're not going to do all the life-saving measures. That's not true. So teamwork is that hospital has done everything they could before the organ donation specialists are called in. The only reason we are called in at the time is because we also have people on our team, such as family guidance, family support counselors, chaplains, that can help the person, the family members around that person accept what's happening, accept the death, and think about the options for that individual to save other lives. Then there's a whole team that comes in and does the surgery. Then there's a whole team that does the transplant. Then there's a whole team that provides bereavement counseling back to the family members that lost their loved one. Then there's a team of people that if the person who received an organ wants to meet the family members of the person that died and donated that organ, we can facilitate them meeting. There are videos online about this guy was running across country to raise money for organ donation, and he got to put on a stethoscope and listen to the heart beating inside the man. And it was his daughter that passed away, and he got to listen to the heart beating inside someone else. So when I can't think of another industry that is way more teamwork than organ donation, because it is a lot of people. There's something else really cool that happens when someone's a donor. A lot of hospitals do an honor walk. So they're leaving the ICU in their bed. They're being wheeled down the hallway to go to surgery to donate their organs. All the family members in the community and the clinicians that have been part of that person's care line the hallway as a moment of silence, knowing that that person is about to save several lives in their passing.
How do you make sure everything is done accurately when time is limited and stakes are high?
Oh, yeah. Good question. We go through rigorous code of ethics counseling. We talk at length about how donor families cannot be induced or persuaded. It is their choice, or it is that individual's choice if they chose to put it on their driver's license. Most every job I've ever had has had a very in-depth quality and regulatory department to make sure that we follow the rules set forth by the United Network of Organ Sharing, the FDA, Centers for Medicare and Medicaid, Health and Human Services, because it can't be an induced system. It has to be fair and equitable. And you're kind of told that from the very beginning that this, you have to treat every patient as if they were your family member or yourself, with a center of excellence, and stay true to HIPAA guidelines and all those things. So it's a very regulated industry, and you can be weeded out pretty quickly if this isn't the field for you or you try to do something inappropriate.
What is a mistake you see students commonly make when preparing for health careers, and how can they avoid it?
Excellent question. I say, like I said, do your homework. Make sure it's really the avenue you want to go down to. Do some job shadowing. If you have the opportunity, like Krish, I think you said you're interested in cardiology. If you could spend a day or two in a cardiologist's office, even talk to the patients, do some type of on-the-job shadowing to give you a glimpse of what the life is like, because then you really know what you're getting into. With HIPAA regulations, that can be difficult, but this group that you're in with Janice and everybody is a really great opportunity to figure out those avenues to talk to people like me who've been exposed to other things. So keep doing this type of stuff. Keep doing what you're doing. Get yourself out there to volunteer in the healthcare setting if you can do that, because that'll expose you to a lot of things to prepare yourself of what you're getting into. You want to make sure you're not queasy. You want to make sure if you want to be a surgeon, you're not going to faint. So
prior to us starting, we were talking, you said that what doctors are happy with their job and who are really not. So do you mind elaborating with what you've seen personally?
I've been around some doctors who have said if they had it to do over again, they probably wouldn't have become a doctor. And it's been doctors of all different types of practices. But I think what the legs of behind that is that it potentially took them away from their families. They didn't have a work-life balance, or their specialty got phased out by other things. And what I mean by that is sometimes us as human nature might sidestep a general practice provider or a PCP. If we feel we're having heart problems, we're going straight to the cardiologist. So I think they feel disassociated a little bit. And I don't know that the generation of doctors that I got the opportunity to work for did that job shadowing. And did that, like, they didn't have that balance in residency programs that they have now. Like, you've got to get home and sleep. It's not like Grey's Anatomy where they went on no sleep and they're like doing all these things, right? You have to have that self-care balance. You have to talk to a trauma specialist if you witnessed a really bad car accident and tried to save someone's life, and then you go home and you're having nightmares about it. I'm not sure that the generation of doctors that I have had the experience working with did a lot of those things that I think you all are thinking about right now and adding to your education path and your early career path.
So thank you, Mrs. McAfee, for your time tonight and sharing your experiences with us. We truly appreciate your insight and found this session incredibly informative.
Awesome. Thank you so much.
Thank you.
You guys
We're
have a
now
great
gonna,
evening.
yeah, you too.
Thank you.
We're now going to display the QR code for attendance. Please make sure you complete the form by tonight to receive the credit. This session will also be posted on our YouTube channel soon.
Thanks, everybody.
Thank you.
Thank
Bye-bye.
you.
You.